Welcome back to the Morning Blend. Has knee pain kept you from enjoying life? It's summer, and that means now is the time to do something about that nagging pain. Stacey Roberts is back from New You Health and Wellness with new technology that means no surgery, no expensive injections. Good to see you, Stacey.
Great to see you, Molly. So good to see you back.
Thank you. I'm happy to be back. The other thing I'm happy about is you sharing your knee story, because you and I have talked about this before, and I think it says so much about this technology that you have now in your office that you've used it yourself.
Absolutely. So I've used the SoftWave technology on my own knee when about a year and a half ago it's been already. I was doing the polka with my son and trying to teach him how to do it. He's 24 and he wasn't doing a great job of it. And then all of a sudden I heard a big pop in my knee and searing pain. And my knee immediately began to swell up and I kind of pulled myself off the dance floor. The beer barrel polka took me down. So I was waiting. It still swelled up. I could barely walk to the car. And I needed crutches to walk the next day because I couldn't put any weight on it. And I right away had my SoftWave device in my clinic. So the next day I took my crutches, went into the clinic and did some treatment on my knee. And I was finally able to put a little bit of pressure on it. You'll see in a little bit what that looked like. And then after second treatment, I didn't need my crutches. Third treatment, I was walking without pain. And now I don't really have any pain at all. And the doctors told me that I would need a knee replacement because there was so much arthritis in that knee that was clearly there before I hurt it, but I never had any pain. So significant, there was a significant reduction in pain. You'll see here, this is right when I first heard it.
Ouch.
Yep. Couldn't put any weight on it.
Ow. Yep.
Yep.
I think people can so identify with this, Stacey. And here's the technology.
Yep. This is the SoftWave technology. So basically it's taking these electrohydraulic, it's shockwaves that are going through this electrohydraulic applicator, which looks like this, into the joint, deep into the joint to get to the inflammation. So what really made a difference for me was deep into the joint made a difference in decreasing that inflammation that was related to arthritis that I had in the knee. And now this is after the first treatment, I'm able to walk much better, clearly not perfectly. But then after the second treatment, you could see me, I love my black sock here, but you can see me walking a lot more normally, but I still couldn't put like all my weight on that leg by any means. And then after the third treatment, which will be coming up soon, you'll be able to see, me walking relatively normally.
So what I'm wondering is, did your doctor ever suggest a cortisone shot?
Yes. So the doctor suggested a cortisone injection. And I said, well, some of the new data on cortisone injection is that it actually increases the degeneration in the joint instead of healing the joint. So I might get short-term relief, but the long-term issue is potentially degrading my knee even more. So I did not want to have that option at that time. I wanted to see if the SoftWave technology worked, and thankfully it did.
It's an incredible story. I know that the information that you just shared about cortisone injections, they shared with me about my shoulder. And I was very thankful I didn't have a cortisone injection because, for one thing, they say often you then can't have surgery for several months if you really have to have it. The other thing is just what you said, it weakens those ligaments. And so if you do need surgery, it's more prone to failing, but also it can be bad for long-term recovery. Now, the fact that you were able to do it with these 3 treatments is incredible, especially because what I want to share with people is that it's not painful. I've had it done to my ankle. We've talked, I have massive problems, constant swelling in it. And you did this SoftWave technology on my ankle, which really helped. And the treatment itself doesn't hurt.
Right. It's a bit more sensitive than pain. And sometimes when you get to the right area, on the right area, you'll feel a sensitivity. But a lot of times people say, ooh, that's kind of a good hurt, so they feel like it's doing something, feel like it's working when you're applying the technology. And we can turn it up or turn it down depending on what the patient's comfort level is. Right. So that's really important to understand.
Yes, and I know you're very open to feedback from people like, oh, okay, it's a little bit sensitive there. And what people are looking at is a technology, and then there's sort of like an ultrasound type gel on the knee to help with the transference of it.
Of the energy, correct. It helps to conduct that electrical energy from the shockwave into the knee. So, and again, it goes deeper. This device goes deeper than any other device that's on the market. Most of the other ones go like an inch or so deep. This gets right into that joint where the problems typically are.
So people are going to say, okay, so you had these 3 treatments. It's incredible looking at that video, knowing you really can't walk, you're on crutches. And then after just 3
Right.
treatments, not only are you able to walk on it, we saw you stand on one leg, you said you're pain-free. So moving forward then, have you had to do any sort of like follow-up or maintenance treatments?
Sure. What I do is preemptively treat it. I typically don't have any pain whatsoever, but what I notice is if I eat certain foods that tend to cause that are more inflammatory in my diet, I can get some aching in that knee. So then what I'll do is every 6 or 8 weeks, or maybe sometimes even every 3 months, I'll have another maintenance treatment. And then sometimes I'll just do one even if it's not hurting, just to keep it from hurting. Because remember, what it's doing is decreasing that inflammation inside the joint. So that's helping me keep it from hurting in the future, and also me being able to exercise then without pain keeps the muscle strong and keeps that support and stability in my knee and hip as well too, which is important for my back and other joints as well.
Yeah, it is. I'm such a big fan of what you do. We ran out of time, but I want to make sure people also know it's not just knees. You've treated necks, ankles, as I mentioned, knees for sure, shoulders.
Plantar fasciitis, any musculoskeletal issue, you can give us a call, and we've got a 15-minute free consultation, but you guys also talk about the special that we have too.
I will do that right now, Stacey. It was great seeing you. Thank you so much for sharing your story. So helpful.
Thank you so much. Take care.
Yep, you too. Great to see you. And right now, New You Health and Wellness has this introductory offer. Here it is. For $79, you're going to get an abbreviated treatment so you can see what it's like, and the opportunity to sit down and talk with Stacey to discuss your situation for 20 to 30 minutes. Now, to take advantage of this very special offer and to get rid of your knee pain or your ankle, shoulder, hip, whatever it is, call 414-299-8121. Also, for more information, you can visit their website. It's newyouhealthandwellness.com.